Dr. Nagla Karim from the Southwest Oncology Group presented an interesting trial in the setting of small cell lung cancer that is not going to change practice right now, but it's a question of, what does this mean for the future? How encouraging is this? This is looking at a PARP inhibitor, which is a targeted therapy. There's some preclinical lab-based studies that show that patients with small cell might benefit, but there have been a few different trials with PARP inhibitors in small cell that have suggested modest benefits in disease-free survival, nothing that's going to change practice. This was looking at a selection of patients based on a target called Schlafen-11 that is seen in at least 50%, maybe more, small cell lung cancers, and may be associated with particularly good response to PARP inhibitors. And this looked particularly at giving a PARP inhibitor to patients with small cell lung cancer who had received chemo with immunotherapy, atezolizumab or Tecentriq. So typical treatment for extensive stage small cell lung cancer. And if they didn't progress by 4 cycles, they'd be randomized to getting just ongoing maintenance Tecentriq as a standard of care, or that with a PARP inhibitor called talazoparib, and looking for time until progression. It showed an improvement in disease-free survival. It was statistically significant, not a dramatic difference, but a 30% improvement and over a month of difference. So whether that would be considered clinically significant or not, it's debatable. The toxicity, the added side effects were mostly in terms of blood counts. There's no hint of an improvement in overall survival, but our challenges in small cell lung cancer it's always a hard fought battle. It's a tough nut to crack. And just interested in what you think of this work, whether it's just not enough, too little, too late, or, we've been looking at PARP inhibitors, but we've not done trials that select patients based on molecular features in this. And Christine, maybe you can comment on your thoughts of what this represents to you for now or the future.
Yeah, so I'm going to say and take a step back and say, as much as we drill down for non-small cell lung cancer and say, what biomarker and subtypes of subtypes of subtypes, it's do you have EGFR or not, and what type of EGFR mutation, that does not exist in small cell lung cancer on June 16th, 2023, as we're shooting this video. There is no precision medicine yet or personalized medicine yet for small cell lung cancer. It just doesn't exist, and we don't have biomarkers for small cell. And so I think a success of this trial is that they did use a biomarker stratification, or they used a biomarker to help select the therapy. And I would say the trial here, the biomarker and the drug was based on the best evidence that anyone could generate leading up to the trial. Some very, very, very high level evidence to support this combination before the combination went into patients. That said, I think the results of the trial were not what we wanted them to be, and the toxicity is not what we wanted it to be either. And so we have a lot of work still to do in small cell lung cancer. I hope that there will be more precision in small cell lung cancer going into the future. This trial makes me hopeful and encouraged that we can do biomarker selection in small cell lung cancer. And I would say, just ending on a message of hope, that there is a tremendous community studying small cell lung cancer. There's a lot of drugs being developed in this space. And so I think, when we do this again next year, if Jack's nice enough to invite us back, Alfredo, then, maybe we'll have 2 abstracts on small cell that we'll discuss that will be novel agents that really, push the needle for small cell, because we really need to push the needle in this disease.
Alfredo, what do you take home from this?
Yeah, I totally agree with Christine. I can only add that there's a lot of, even in Switzerland, we have a lot of interest for this biomarker. And but when I saw the data, I wonder, it's interesting. And also wonder, is it the biomarker the problem? Is it the drug the problem? Is it the assay the problem? Maybe immunohistochemistry is not the best way. So I agree. This, it's good that we are seeing this kind of trial where we're trying to be more selective and base the treatment on some biomarker. The data we've seen, I mean, are overwhelming, but there's a signal, and I just wonder whether maybe we can improve maybe the assay to detect the mutation. Maybe this is the key, because every time I see that this biomarker is overexpressed or mutated small cell lung cancer more than 50%, then is, I struggle a little bit to believe that. I struggle to believe that we have such a large diffuse biomarker for small cell lung cancer. So this maybe is the only issue I see, but and I'm also hopeful that in the next 12 months or 24 months, we might see more, targeted treatment for small cell lung cancer.
So a foot in the door to
I think so.
selection.
I think so.
Okay.